everybody who came, but obviously some people are finding this a very important topic, as do we at the Center for Security Policy Studies. I'm Ellen Laipson, so I direct the Masters in International Security and the Center for Security Policy Studies, which is a student-led set of activities. This is one of them. And we're really excited to have a panel that will bring three very distinctly different areas of expertise and insight into the coronavirus and international ramifications. So we'll learn a lot about the public health dimensions of it, but hopefully put it in an even larger context of what it means for international politics, for U.S.-China relations. We're really going to cover and what the lab science thinks is distinctive and important about this particular public health crisis. So I'm really thrilled. I'm going to introduce the speakers as they start, if you don't mind, so we won't have too much information at the beginning. Steve Morrison is the Vice President at CSIS and the founder of their Global Health Policy Center. A good number of years ago. I've known Steve over the years as an Africanist, he was a Hill staffer, taught at CSIS for many years, and he served in the State Department in the Clinton administration. At some point, we're going to ask Steve to tell us about what was the early thinking around creating a global health policy center in a think tank that does international security. So it's a little bit bridging two communities who are interested in distinctly different arenas of international affairs. But I really want him to help us understand how they came to see the connections between the two. I think this crisis that we're focused on today is a perfect example. But Steve's first remarks are going to be on his recent experience at the Munich Security Conference. He was, I believe, on a panel with both Chinese and World Health Organization officials and can share with us how is this crisis looking and how is it being talked about at the global level. Who are the institutional players? And how is the crisis seen from that perspective? So Steve, welcome to the Schar School, and we're eager to hear about your recent insights.
Thank you, Ellen. Thank you for the chance to be here, and welcome to you and all, and good evening. On the COVID-19, the coronavirus outbreak, before I say a few words around what transpired last weekend in Munich, just a couple of very quick things to keep in mind. One is humility. This is an astonishing outbreak. It involves astonishing public health measures that have been put in place, the quarantines, the travel bans. We'll talk about those things. There's many, many unknowns that persist throughout this, so being humble is very important because what we think we know today is different from what we think we'll know tomorrow. And the other thing is the human dimension of this crisis gets lost in much of the discussion. There are hundreds of millions of people in China who are living in fear and danger and concerned about their family and friends, and living in the midst of considerable uncertainty. And that human crisis and the scale of that human crisis sometimes gets lost in the discussion around what is happening, and is this something that's containable, or is this something that's going to morph rapidly into some form of a globalized pandemic? All of those debates are fully upon us, but we need to keep the focus on the suffering that is going on and the danger of being unable, if this escalates, to meet the immediate human requirements in China or elsewhere as this morphs. At Munich, at the security conference, there were a couple of interesting things that happened that were unprecedented. One was that Dr. Tedros, the Director General of WHO, came and spoke on the plenary stage to the gathering. And that plenary stage is usually reserved for heads of state, and ministers of defense, ministers of foreign policy, foreign affairs. Tedros had wanted to come over since he stepped into that position July 1st of 2017. This year we were successful at making that happen, and his message was very mixed message. It was, the Chinese are doing lots of good things. We, those of us outside of China, are the beneficiaries of the draconian quarantine measures that have been put in place that are buying time for everyone to become better prepared. He also was cautionary as he is every day now in the press accounts, in saying the window is closing on containing this. It's not yet shut, but it is steadily closing and rapidly closing. We need to be very, very cautious in how we think about this and how we prepare for this. The other thing that happened was the Chinese foreign minister spoke, Wang Yi, on the full stage. And of course, the confrontation with the United States was the single biggest issue on the table, particularly around 5G and Huawei. But the second order issue was the response. And again, it was a very strongly worded statement around, we are doing the best we can, we will contain this, we are doing it to protect our people are not resisting or rejecting this, ignore all of those questions that are being raised in the media and elsewhere about discontent, turbulence, human rights issues, etc. That this is the way we're moving ahead, and support us. That message, when we had the town hall, which had the deputy foreign, which I organized and moderated, we had the deputy foreign minister, we had the head of operations for WHO, Dr. Mike Ryan. We had from the Wellcome Trust, Jeremy Farah, the president of the Wellcome Trust, who lived in Vietnam for many years during the SARS outbreak of 2002 and 2003, and plays a very important role right now. As does the Gates Foundation. We had Oren Levine from Gates, which had pledged $100 million a few days before that towards the response. And then we had Professor Tong Bei, a professor from Shanghai Institute for International Studies, she described what I'm hoping we'll hear from Ketian, the sort of response, the response of populations that were calling on hotlines, who were talking in their communities, trying to give a textured sense of how are people responding to all of this. I would say, just in terms of other major impressions, people are tiptoeing around the Chinese government because they don't want to defend the Chinese government. They don't want to offend them. They're continuing to be hopeful that scientists will have access, epidemiologists will have access. There is a team that arrived, the first team. There's been a very strong sort of arm's length relationship to the offer of external epidemiologists to come in. The epi data has been guarded very closely. It's beginning to be shared, so it's beginning to be possible to begin to understand the spectrum of illness. And the argument that is being made very quietly from our government and many other governments is that in order to prepare for the possibility of an outbreak that could be an explosive outbreak within our population, on our soil, we need to understand the epidemiology of this in the fullest possible way. And not having data is a barrier, a very significant barrier to preparing ourselves, much less to understanding and helping to advise the Chinese. That issue has not been resolved, although it looks as though there is more cooperation. There are two American, very senior level scientists on the WHO delegation, which is in China today, in which there will be more. There's a lot of concern rising about transmission into countries with weak preparedness, weak institutions. There are 13 African countries that have very high traffic back and forth with their Chinese partners, and those have been designated as high vulnerability. Tomorrow, Tedros will be meeting with Africa health ministers to talk about this. There is a sense that in terms of the transmission and the next phase, and we're now at a moment where we've seen geographic spread suddenly in the last couple of days, we're seeing spread within a dramatic uptick in Beijing, quarantine of hospitals there, spread into other provinces, and now we see what's happening in Korea, Italy, Iran, and elsewhere. It's been a very busy week, and people are sitting on the edges of their seats as to where are we. The one thing that also comes across very clearly is that we don't understand the transmissibility and the severity of this illness. We don't have very good testing capacity to know where it is and when it's there. We're in the dark in a very significant degree, which gets back to the humility question. So I think I'll just stop there. Thank you.
What's the threshold to when it's called a pandemic? Are we getting close? Is it the number of countries?
Pandemic is when you have efficient, sustained, human-to-human transmission in a second continent.
We already have that.
Well, we're getting to that point pretty rapidly. And you know, if you go back to the swine flu outbreak in '09, Margaret Chan was the head of WHO and declared that H1N1 was a pandemic, and then it petered out and was not as dangerous as people thought, and she was hammered because
She overstated, yeah.
well, when you decide, okay, this is dangerous enough, we need to lean forward and prepare, you put yourself at a certain risk that if it doesn't happen, you'll be accused of forcing governments to go out and buy vaccines on a massive scale with limited budgets. And then they are stuck with this, and it looks like it was a boon for vaccine manufacturers, unnecessary, et cetera. In other words, once you get a global pandemic declared, certain obligations and pressures come into force for governments to begin to prepare on a whole different scale. And we can talk about what that means in terms of purchasing and manufacturing and distributing vaccines, which is a whole other area of very intense debate right now around how to do that, who does that, how feasible will that be, and so this trigger moment, I think Tedros will be very cautious in the timing of that. It took 3 meetings of the emergency panel, the emergency committee, to reach the judgment that this was a pandemic health emergency of international, public health emergency of international concern. You know, that step put it into another category, and the Chinese were very resistant to that, and the neighbors were very resistant to that, but they took that step. So the next step is one that will be taken, I think, with a lot of caution.
Thank you. That was great, Steve. I'd like to turn to Ashley Grant now, who's a professor here at the Schar School in the Biodefense program. She's a biotechnologist in the private sector. She has a really quite remarkable background. She was the senior biological scientist at the Government Accountability Office. She was a AAAS fellow in the Department of Defense. She has her PhD in experimental pathology and a master's in public health and epidemiology. So you're the closest thing to a medical doctor we have in the room, so we're counting on you.
Well, we don't know. We haven't taken a survey yet.
That's right. But we really welcome your sharing with us what's the state of the lab science, what does the kind of epidemiology and science community think is happening.
Sure. Well, thank you all for being here on a Friday night instead of at happy hour. And it's nice to see some familiar faces. I see some students from my class, so hi. Anyway, I had to bring up this map, which was done by Johns Hopkins, and it's updated pretty much every couple hours. And I learned at CSIS a couple days ago, or actually it's probably a week ago, that this is actually done by a grad student and a professor. And pretty much worldwide, a lot of people are using this graphic overlay to look at where the epidemic is happening, the number of total confirmed cases, and some of this might be more accurate than some government agencies. So kudos to Johns Hopkins for this. But I brought it up because I didn't want to look at it this morning because the numbers could have changed. So brought it up to right now, and the case fatality, which is pretty much the total number of deaths divided by the total confirmed, is around 2.93% right now. Could change, we could refresh it even right now. But in terms of my thinking, I think to the scientific community is that there's a lot of, we don't know what the total confirmed cases are. There might be a lot of people that might have a headache or went out last night and not feeling too well. So those people might be infected with COVID-19, but they're not being diagnosed and confirmed because they don't go into the doctor. Maybe they're staying at home in their quarantine. So those, we're not capturing those number of cases, so we really don't know the total confirmed cases, or maybe even the total confirmed deaths. So if there's someone that dies that maybe it could be attributed to another cause, we don't know that either. One of the most interesting things that they changed the last couple days is if you look at the left-hand side, under mainland China, the others, can anybody guess what that's from? The cruise ship. So that was actually labeled the Diamond Princess until that I just looked right now. So it's very interesting that out of all the countries in the whole world that have reportable cases, that a cruise ship is the second most compared to mainland China. So interesting in terms of science. We do know some science. CDC has, there's evidence that CDC has on their website that it's spread by droplets, people within 6 feet of each other. And there's some evidence of fomite, so I touch something, I'm infected, you touch something, but we really don't know how long the virus lasts outside the body right now. We don't know that transmissibility. And then in the SARS epidemic, which is the most closely related coronavirus, most closely related virus that we know of that infects humans, there was actually super spreaders. So someone who came into a hotel and spread it to a lot of people. So we don't know at this time if there's people that spread it to, in epidemiology called the R0. So it's the number of people on average that a person would spread it to. We don't know that number right now. So it could be 6, it could be 36, and it could also be a range based on those individuals, what they're doing. We also, important in epidemiology is something called risk factors. So what makes someone more susceptible to either death, getting infected, and that's why it's really important to have epidemiologists go into China and try to figure out, and the cruise ship, and try to figure out what's happening, because we don't know if a certain ethnic, genetics, maybe a behavioral thing. So maybe someone who's vaping is more likely to get it, or someone who's pregnant. Right now there's an increased risk of being older and male, but there might be other risk factors that we don't know about that we might learn more by getting more and additional information. We learned that the WHO, it was I think on January 30th, declared a public health emergency of international concern, and the next day the HHS, Health and Human Services, declared a public health emergency. So that kind of activates them in a similar manner of being able to spend additional funds, do additional research, and for those who aren't familiar, there's several different parts of Health and Human Services that are working on this. So the National Institute of Health, or NIH, they're working on more basic research. So looking at trying to develop the new vaccine, seeing if it works against a vaccine that was created for coronavirus, SARS, works against this COVID-19. They're also looking at medical countermeasures, and also trying to study how long the virus spreads out, exists outside the body, or its persistent survivability. In terms of BARDA, the Biomedical Advanced Research Authority, Development Authority, they're looking into medical countermeasures. So how is our country prepared? And they're in charge of the Strategic National Stockpile. So how is our country prepared in that sense? Do we need more ventilators? Do we not? Do we need certain vaccines or therapeutics? Could we use therapeutics for other viruses that could then be applicable to coronavirus, to COVID-19? And then FDA. So ultimately, the Food and Drug Administration has to approve the diagnostic test and any medical countermeasure that is being used in humans. So no matter what, if you say I have the greatest thing ever, it's going to solve all of our problems, it still has to be approved by the Food and Drug Administration. So FDA is also working on making sure that we have a path forward in terms of not only emergency use authorization, but also in terms of medical countermeasure development. Let's see, what else?
So when they called it COVID-19, does it have markers and an identity that's different than other coronaviruses that we've known in the past? I mean, is it considered more dangerous than other coronaviruses?
So I think it's too early to tell. So SARS has a higher case fatality rate according to the data, and it's most closely related to SARS in terms of the actual sequence, in terms of viruses that we know about. But again, it's a little bit too early because we don't know exactly what those numbers are, and that's how we kind of determine how deadly it is, how much it spreads, so more information is needed.
I was going to suggest before we go to Ketian, whose presentation will be quite different, I wanted to invite both Steve and Ashley to talk about information sharing at the global level.
Sure.
The WHO, what authority does it have to sovereign governments? Do sovereign governments have the, can they just sort of say to WHO, sorry, our scientists are smarter than yours, we're going to do it our own? So talk to us a little bit about that dynamic.
I just want to talk really quick about where the science was during the SARS epidemic in 2003 versus where it's at now. And amazingly, we have next generation sequencing, and we have a amazing capability that we didn't have back in 2003. So within weeks or days, that sequence was up online for COVID-19, and scientists around the world, including scientists at the Centers for Disease Control, and I didn't mention Center for Disease Control, obviously they're involved with the epidemic response, but they were making diagnostic tests against that, where it would have taken, in terms of sample sharing, before we'd actually have to get an actual sample, and then I would have to try to make primers against it. Now it's blasted out online, and you can try to make, and we come and advance our technology that we can make primers, synthesize primers, and make diagnostics on the other side of the world with just the sequence. So maybe information in terms of the actual sample sharing isn't as important as it was maybe 15, 20 years ago.
The sharing of the genetic sequencing data, which was January 10th, that was essential in order to get the wheels moving, right, on getting tests and getting vaccines into field trials and getting antivirals, which could be repurposing existing antivirals or getting new ones developed. This is a brand new virus. It's part of a class of coronavirus, but it's brand new and it's very fast. It looks to be less deadly than SARS, but when you say 2.9 to 3%, if that turns out to be true, that's still very, very dangerous, but we don't know what the denominator is because there's a lot of mild or asymptomatic illness out there that's not getting picked up or tested against. And this gets to, if you're only testing for people who are really sick, that's what you're going to get. So it may be that this is 1%, but keep in mind, seasonal flu in the United States, which kills 35,000 people a year in, year out, and some years it bounces up to 75 or 80,000 as it did 2 years ago. It's 0.1% fatality rate. So a 1% fatality rate on this, if it comes to the United States, is a very serious development. If the infected population becomes large. And there's been various modeling going on now. Neil Ferguson and others at Imperial College, some of the premier modelers are going out and saying the data that's so far we think there was 1,000 cases. Give you an example. We think there were 1,000 cases proven to be exported from China into other environments. Well, today Ferguson came out and said, well, actually we think it's 3,000. And there are various projections being made around the probabilities of this globalizing and what percentage. And if you look at some of those projections, they get very large very fast. On the obligations, you have the sequencing data, but then you have the epidemiological data that is very important in understanding the spectrum of the illness, all of those things that Ashley was talking about. And we also need, on top of the existing epi data, we need serological surveys to be undertaken. Blood drawn from a broad population looking at antibodies within the population to understand the true spectrum and scope of illness. That has been withheld. And so it's a very limiting factor on our ability to understand what this disease will mean if it arrives on our shores.
So someone who had coronavirus and then got better, aren't they an important source of knowledge?
Yes. And so you have international health regulations, which were revised in 2005 after SARS and after some of the pandemic flu experience. They came into force in 2007. Ashley can tell us chapter verse on all of that. There are legal obligations of a convention, international convention. But at the end of the day, sovereign governments make sovereign government decisions. WHO has limited leverage and sway over any government, whether that's DRC with respect to Ebola, which is a relatively weak and chaotic government, or it's one of the most powerful governments in the world in the case of the Chinese. Dr. Tedros and his staff have to use their persuasive powers as best they can. They have to be patient and deferential. One of the things in their defense, they set standards and they facilitate dialogues. Last week they brought 400 scientists together in Geneva and virtually for a discussion around the vaccine, the countermeasures, the testing, diagnostics. They demonstrated their capacity to convene and mobilize the world's best minds on these critical issues and begin to chart the pathways. And so that's terribly important. And the other thing to keep in mind is if this globalizes, or if it stays confined to China largely, where they face a terrible problem, we will not have vaccines for at least a year and a half, realistically. We may be able to repurpose some antivirals, and there's some trials underway. There's over 80 field trials underway today inside China. But we are without a vaccine and without a dedicated, there is no cure. And antivirals are experimental at this moment in time. So technological toolkit is pretty thin at the moment, which leaves you reliant on social distancing and quarantining measures, personal behavior, the sorts of things that I think we're going to hear from you about. Those are what the Chinese are relying on, and that's what we're going to be relying on, and everyone else that faces this outbreak. So you have to begin to think about a phase without those technological tools, and what are going to be the key gaps? Is it going to be oxygen and ventilators? Is it going to be protective gear for your health workers? Is it going to be infection control in clinics and hospitals? What we're learning in China is very high rates of infection of health workers. They came this week admitted to 3,000, which shows the dangers and the difficulties of this. This is a very wily virus, and it's very hard. It spreads fast, and it's hard to control against, apparently, in the hospital and clinic settings. And if you have 3,000 infected health workers, that's very, very problematic. So we have to be planning for that gap period, but we also have to be getting vaccines and virals under development very fast, finding out the money required for that, and getting the manufacturing capacity in place, which if it does globalize, we're talking about 500 million copies of a vaccine. And who has the capacity to manufacture those? And who's going to pay for it? All very big issues. And if you wait too long, you're punished. If you jump ahead too much and it turns out to be a dud, you get punished for that. So it's a tough decision process right now.
Let's bring Professor Ketian Zhang into this conversation now. Steve Morrison said at the beginning, let's keep in perspective the kind of human dimension of this. And Ketian can share with us a very human and personal story. She's a micro data point of someone who was in China during the outbreak, got on the last flight back to the United States before United Airlines suspended all of its flights, and can really give us a little bit of the ground truth of what it was like. You've been back 2 weeks now, but what it was like while you were there. But more importantly, she's a professor here at the Schar School. She is an expert on Chinese foreign and national security policy, and teaches East Asia, international relations. So we're going to have you talk on two different levels maybe. Tell us the China story, but also what you think are the longer term implications for U.S.-China relations and for East Asia in general. So thank you.
Hi everyone, thank you for coming today. And let me know if you can't hear me, because sometimes it might be difficult for me to project. So today I'm going to cover three aspects with regard to the coronavirus in China. So the first one's obviously somewhat of my interesting personal story, and a story shared by family members still living in China. And the second concerns the sort of domestic, political, and economic implications for China. And both points are relevant because for the third topic, which is really about the coronavirus and international security, as well as U.S.-China relations, because if the Chinese domestic, political, and economic systems are not stable, it'll have very interesting and sometimes adverse implications for U.S.-China relations in the future. So with regard to the first point, I remained in China until January 31st this year because of an unfortunate delay in visa processing issue with my work visa to come back, and therefore actually experienced part of the coronavirus episode. So full disclosure, I was very close to Beijing, and it was not thus at the epicenter, which is further south in Hubei province, and especially Wuhan. So my city only has about 20 cases of the confirmed virus. So just a little bit of a background about how this all got started. So there were reports about this type of new virus in China even back in December last year. But the central government and the local government actually censored the information. So up until mid-January, the government actually alleged there was no people-to-people infection or transmission. And that's why, including me and my family, we're actually not concerned because we thought that this is not going to spread outside of that particular city. So this is until January 20th or so, when the government suddenly allowed information regarding the virus to spread, basically indicating that there was in fact people-to-people transmission. So obviously, everyone got anxious, and as Steve said, this is a new virus, so we don't know. There's a lot of uncertainties around it, so everybody was very afraid. So I was actually grounded at home from January 20th up till the 31st and never set foot outside. So basically, that was a 10-day self-isolation. So I got the visa first thing and went back on the 31st, and our United flight was actually the last one to Dallas ever because a travel restriction was announced when we were midair, basically. And that basically means that foreign nationals who travel to China within the last 14 days were banned from entering the United States. Obviously, if you have a Canadian visa, you can still travel to Canada in principle and then stay for 14 days and then come to the United States. But in principle, in practice, not every Chinese national has a Canadian visa. And the embassies were closed, so you can't actually have those visa applications processed. So I still have families living in China, and they're all under tight control. So I'm just going to give several examples of what Steve and Ashley mentioned in sort of the timing control of the Chinese government on the movement of the population. So this is one permit shared by my uncle who lives in or on the Tibetan Plateau. So another province that has barely any cases, probably about 15 cases of the entire province. So basically, these permits are pretty much common and normal for every Chinese national or citizen living in China right now. Basically, that meant that every household has such a permit, and every household is only allowed one permit. And for my family, you can only leave your residential area, i.e. apartments, because most Chinese in the cities still live in apartments. You can only leave your apartment every 2 days for 2 hours. And only one family member within a household can leave. And if you have to work, you have to gain a special approval and permit in order for you to actually go to work. And of course, a lot of the people don't really go to work anymore because the factories are closed, and a lot of the government offices rotate their workforce as well. So this is another example of the temporary permit. And these sorts of restrictions are still in place even as of now, and it's unclear when they're going to be lifted. And the other sort of measure is that if you travel from another city back to your home city, you can't go back to your home. You have to be transported to a hotel designated by the city. Obviously, you're provided with food and lodging for 14 days, and after which you can return to your home, even if it's not from the epicenter. And obviously, if you don't know, the entire province is already locked down. So all transportations are closed. The people there even couldn't get out. And the other thing to note is that there are some local initiatives, i.e. some of the policies are actually not originally sent top down. They're actually policies initiated by the local, say, villagers. So some villages in China actually made their own policies, building roadblocks with tractors or trucks, etc. Basically meaning that no villagers can leave their fellow village and no outsiders can go in as well. So that's a lot of measures taken by or on a level that's really at the local communities. And obviously, medical resources are running short, so people sometimes have to improvise, right, including masks, etc. So here are some examples of how the Chinese citizens actually cope. So this is one photo that I took of Beijing, which is really just a 10-minute walk from the U.S. Embassy in Beijing. Usually this area is in the central part of the city, so highly vibrant, but that was 4 p.m. when I took the photo, and you barely see anyone. And that's basically what you see in terms of the entirety of Beijing. So that is quite shocking if you know about Beijing. All the time you see tons of people. And obviously this is the airport. You don't really see that many people, and everybody basically wear masks. And what happens if you don't really have masks? So that's so this is a fairly famous photo on Chinese social media. An elderly person living in Wuhan, the epicenter, having to go to the hospital but didn't really have access to medical masks anymore, so that's an orange mask made by himself. And obviously much more tasty and actual medical masks. And obviously we do have your dogs, right? So that's what we do. And if you have to go to the hospital sometimes and want to have full protection and don't have the gears, then that's what you have to do. So people are pretty creative. Those were shared on social media, and there are many more instances of that. And obviously, this is something we're going to talk about later. The doctor who spread the news that there's this new virus back in late December and later died because of this virus. Right, so that's basically the sort of a situation on the personal level, and sort of back to Steve's mentioning about how we don't know how serious the situation is, especially with regard to the number of confirmed cases. So I do have some anecdotal stories being shared by my brother-in-law who graduated from Wuhan many years ago. So he has a lot of colleagues and friends who work in hospitals in Wuhan. And according to them, the doctors, they were saying the cases might be 20 times the confirmed cases. Obviously, we don't know how many times more the actual cases are out there, but I think the bottom line is that there are way more cases than what's being released by the government data, and importantly, a lot of the hospital, the medical workers are probably among the population that's most affected because they don't really have any protective gears, and people are running short of those protective gears. And for some of the hospitals, they ran without the protective gears for even days.
May I ask you a question? After SARS, the government made a huge commitment to upgrade and transform primary care system, right? And that made vast investments in the next decade. And then we have this outbreak. Were people shocked at the primary level of the inability to handle the outbreak? Would you say? Because it seemed like it just washed over the primary system and people flooded to the hospitals.
I think that's sort of something that's related to what I'm going to talk
Oh.
about later as well. But that's definitely a good question, and I think it also sort of shows that although China might seem like a strong economy and a supposedly formidable power, but in terms of its basic infrastructure, both in terms of physical capacity and institutional capacity, it's way beyond, or it's going to be a long way before it becomes a sort of strong power in that regard. And I think that's one of the reasons why the public remains quite angry about the government, both at the local and at the central levels, because they're obviously not prepared for these kinds of emergencies. So that's a nice segue into my second topic, which is really about the domestic political and economic implications for China, right? So the first one is about the political implications. At the central level, the Chinese central government tightened media control, especially the control of social media, while trying to divert the blame to the local government. So basically, what China wants to do is that it's not about the center, it's about the local government not being prepared enough, and while trying to cover up some of the information. So in a rare move, and in recent days, President Xi Jinping actually allowed the Chinese official media to publicize an internal Chinese Politburo Standing Committee meeting. So the Politburo Standing Committee is the zenith of Chinese decision-making body, and it's very rare that they publicize the internal speeches within just, say, 2 weeks, right? So in this meeting, President Xi said that he, on January 7th, he said that it was necessary to take measures against the virus, and it was him who made the decision to lock down the entire province. So basically, he was saying, it was not me, I took measures a long time ago, but it's the local province that did not follow through. So that's what he wants the Chinese public to believe. But interestingly, Xi Jinping never went to the epicenter of Hubei. It was actually the Chinese Prime Minister who went to the epicenter. And as for local governments, they first refrained from reporting the cases of the virus, and obviously punished the doctor who first spread the news about the disease. And one thing that's worth noting also about this doctor is that he did not spread the news onto social media. And in fact, it was being shared within the private social media chat group. So something like a instant messaging or a Facebook message, as opposed to being shared or sharing the news to the public. So it's kind of formidable to think that even those private conversations were actually being monitored, because he was being punished because the police found out what they were talking about in their private chat groups, and that's how he got punished. And obviously he was a hero for spreading the news, but it was not shared to the greater public in the first place. So the second thing about the local government is that it might seem that they were to blame, and that is absolutely true. But if you know anything about the Chinese political system, it's a highly authoritarian and centralized political system, right? And it's rarely possible for local officials to make decisions about, say, locking down an entire province or even declaring a new public health emergencies without the consent from the center, especially Xi Jinping. So basically, this really indicates that although local officials are not free from blame, it's really the center, especially Xi Jinping, that is at fault for the delayed response, as well as the delayed considerations about more medical resources, etc. So what's the public reaction in China? So there are a couple points. And the first one is that the public's really, so back to Steve's question earlier, the public's really angry both at the center and the local officials. And it's amazing that despite the tightened control in social media, there are many posts and comments blaming both the central government and the local officials. And what's even more striking is that there are more implicit accusations about Xi Jinping personally, which is something that we don't usually see in the last, say, 5 years, because Xi Jinping has really tightened and centralized control, especially social control, and sort of infusing the idea that he's a great leader, and he's leading the entire country for revitalization to China's past greatness, etc. So it's really amazing to see people actually pointing fingers directly at him, even though implicitly. And of course, these things do get deleted by the government censorship, but people circumvent. And there are many posts that reappear in one way or another, being taken in terms of photos or being reposted by someone else. So you do see a lot of similar posts being shared again. So bottom line, the Chinese Communist Party doesn't really have much legitimacy out of this particular crisis. And the second thing about public reaction, which goes back to something that I discussed in the beginning, which is local community mobilization. So do you remember the villages and sort of the residential areas that I talked about in the beginning? So some of those actions obviously are in line with government instructions, but some of them also sprung originally out of these local communities. So what's interesting about the local sort of mobilization is that it shows localism and local identities, as opposed to nationalism or sort of the patriotic sentiment that the Chinese government wants to instill to its citizens. So this is this episode actually heightens the inter-province competition among Chinese provinces and the discrimination among these different provinces in China, which has actually long existed in the Chinese history, long before the existence of the PRC. So people from Wuhan, the epicenter, and the Hubei province were actually shunned and discriminated against and ridiculed. So what we're seeing is not a unified country, but provinces or even cities mobilizing and competing against one another in a sense. So this is worth noting, because if we're talking about implications for international security, and especially Chinese wartime mobilization and potential of such mobilization, we might not be seeing so much mobilization in the future if there is, say, a similar international crisis or a domestic crisis happening. Because what we see is really a country that's kind of divided according to provincial, geographical boundaries, or a lot of the provincial feuds that seem to have resurfaced. And moreover, the public actually does not buy the Chinese government's portrayal of U.S. restrictions on foreign nationals traveling to China, because the Chinese government made the case that it was highly restrictive with the United States, and the United States should have done that. I mean, they didn't say that explicitly, but sort of they were accusing the United States of being having too much of a stringent policy on Chinese nationals. But the public, some of that, obviously I don't have an opinion poll on that per se, but the public actually thinks that it makes sense for the United States to enforce such policies. And it even cites that the United States is not even the first country that imposes such a policy. So what's the first country that imposes such a policy? Yes, North Korea. Russia comes probably a little bit later, I think after Australia and the United States. So it's actually, North Korea is a supposed Chinese ally that imposed the sanctions or the restrictions on Chinese nationals traveling to North Korea. And also, there is just very little sort of mobilization or very little trust, either among the citizens or toward the Chinese government. And again, that really shows that there's probably, it really shows the limit of the Chinese government constructive nationalism and the potential effect of such a patriotic sentiment or patriotic education. And moreover, we're also seeing a growth of ad hoc civil societies, both from within and outside China. As we mentioned before, resources are really lacking, and the Chinese government doesn't really have that much of a capacity in terms of diverting resources, especially to the epicenter. So it's really civil societies in China, as well as ethnic Chinese communities across the world, that try to transport those kinds of medical masks, protective gears, etc., to the epicenter. And if you've gone to some of these CVS or Walgreens in America, a lot of them are actually running out of medical masks. I'm not saying every Chinese national or ethnic Chinese is buying them, but a lot of them are actually being bought and then sent or mailed to China. And then again, the local officials or Red Cross in Wuhan were not even able to process all of those donations. So a lot of the donations were locked up in the warehouses for a long time before they were even being able to send to the local hospitals. And furthermore, there are voices, because there are so much anger coming from the Chinese public, there are also voices that's really asking for greater political freedom. So that's more about the political implications in the long term, or especially pointing towards greater transparency, greater media freedom, media transparency, and freedom of expression, and less concentration of power. And in particular, there is a speech written by Deng Xiaoping for a long time ago, probably 30 years ago, that resurfaced among Chinese social media that sort of spoke about the danger of concentration. And this is pointing directly at Xi Jinping, who basically concentrates power much more aggressively than, say, previous Chinese presidents. And obviously, there are also interestingly greater advocacy for human rights and especially individual rights. Because in an authoritarian China, the government's focus is really on social development with the collective development of the country as opposed to, or at the expense of individual rights, right? So there are a lot of posts on social media advocating for women's rights. For example, providing more tampons for female nurses and doctors, and not making the word tampon a taboo in the Chinese society, because the Chinese society is highly it's a highly sexist society, and does not really, at least from the government's perspective, does not really care that much about women's rights. And also caring about those who are pregnant during this episode and who weren't able to get access to hospital care or even to deliver a baby. And there are also posts that really is about those who were jailed in prisons, but then got affected through the police in the jail. And that's a huge sort of a source of infection as well. So it's almost like the cruise ship, because they're literally locked up in prisons. And also there are posts and sort of people trying to get help for those who have chronic diseases but were kicked out of the hospitals because those hospitals were turned into infectious disease wards. For example, people with terminal cancers or kidney disease that need dialysis, they were literally kicked out of the hospital, and a lot of them died as a consequence of this particular episode. And finally, there are a lot more posts really advocating for the rights of the doctors who died, and especially advocating for the rights of whistleblowers, and again, greater media transparency, etc. So does this mean that China is going to democratize or not? I don't think so in the near term, unfortunately. But it does mean that Xi Jinping kind of lost the legitimacy in a way. The kind of nationalism or kind of the China dream that he has been trying to build in the past 5 years might sort of be swept away, just my personal opinion, because of this particular coronavirus episode. And as for economic implications, I think it dealt a huge blow to China's economy, at least in the short term or within this year. So both in terms of production and the service industries. So many factories have been sort of closed for about a month and remains closed, probably in the near future. And more importantly, small and medium enterprises in China were the ones that were really badly hit. And those are the ones that are important for, say, the Chinese export industry, right? And also the service industry, for example, restaurants. If they were closed for a certain period of time and don't have really the liquidity to really rerun the restaurant, they're most likely to close and not able to reopen again after this disease. So this is probably going to have a huge impact on the Chinese economy in at least the short term. And also with regard to sort of international global economy and how that might affect the United States, foreign direct investment in China is also seriously affected as well. So for example, Honda the Japanese car manufacturer has factories in Wuhan, the epicenter, right? So it is definitely witnessing a decrease in terms of its car production because of the virus. And so is Tesla, who has opened its first overseas factory in Shanghai last year. And obviously, we're seeing other kinds of U.S. foreign direct investment in China, like clothing manufacturers and the restaurant chains, etc. So we have also seen, interestingly, reports that Western universities, actually, some of them are dependent on tuition paid by Chinese students. And they're also seeing a huge loss as well, including Australia, which is reportedly to be having about, say, a 5 to 6 billion Australian dollars worth of loss because of the travel restrictions placed on Chinese students who will be going to Australia for their education. So one interesting thing is that this episode might push China further down the road of a digitized economy. For example, internet, grocery, online grocery, electronic pay like Alipay, etc., in order to reduce the contact directly with the virus. So that's probably something that we might be seeing in the future. So finally, turning to the implications on international relations, security, and U.S.-China relations. So as I said, there is a huge impact on U.S. foreign direct investment in China, and these actually fuels the voices in favor of an economic decoupling between the United States and China and D.C. So there have been in recent years talk about decoupling the U.S.-China economic relations and technological relations, and obviously this is not something new, but the coronavirus might provide a good excuse or illustration as a danger of economic interdependence. And of course, we've also seen some of U.S. senators, not the majority, sort of talking about a potential conspiracy theory about this disease or virus being produced by the Wuhan lab, which is really the only Chinese lab that's level 4 bio lab that could potentially produce bioweapons. And obviously, we don't know whether this is a virus that's produced by human beings, but these are some of the things that have circulated around the globe, especially among some of the people in the policy community. And that said, the United States, and especially the civil society, actually has been active in providing assistance to China. It just that the Chinese government, again, downplays the efforts that the United States has been providing. So the coronavirus also had interesting implications for U.S. allies, some of which are really in contrast to one another. So for Japan, China actually portrayed Japan as being active in providing help to China. And this episode might actually provide another opportunity for the two countries to warm up its relationship, despite the ongoing territorial disputes among other things. And this is the same thing, again, for the Philippines, who has territorial disputes with China, but has been having one relationship even during this particular episode. And these might actually help China sort of improve or devise its wedging strategy, sort of breaking a U.S. alliance within the Asia-Pacific, which China believes to be containing China. And with regard to Taiwan, and that's a completely different picture. So as Steve mentioned, the WHO, and for Taiwan, it was actually banned from attending a lot of the conferences on the coronavirus because China forbade Taiwan from participating in these conferences because China argues that the mainland government argues that Taiwan is part of China and therefore it's not a government entity. And that is going to be an interesting sort of episode because there has been huge media outcry both in Taiwan and some of the policy community within DC, especially I think we're at the congressional level. So we're going to see, it remains interesting to see whether this is going to push the United States to sort of be more supportive of Taiwan or not in the future. And so very lastly, another interesting aspect that is not necessarily directly related to international security, but might have implications for U.S.-China relations in the long term is really the sort of the resurfaced racist comments or remarks or behavior that we have seen recently because of the coronavirus. And there are reports that some ethnic Chinese Americans were being beaten by fellow Americans in New York because they look Chinese or they wear masks. And also, and I should point out that the Chinese government has been using these sorts of racist reactions instrumentally to push for its own agenda as well. So this is one op-ed written by, published by the Wall Street Journal that has this unfortunate title, China is the real sick man of East Asia. So if you know about Chinese history by any chance, this sort of has a very bad connotation that brings about the Chinese colonial history, especially with regard to the yellow fever and China being this sick man of East Asia, etc. So this is highly offensive and possibly racist from the perspective of ethnic Chinese, not just for Chinese nationals. And it goes way before, goes back way before the PRC was established. So obviously this author did not choose this title. It was obviously chosen by the editor, possibly out of ignorance. But it does sort of have a racist connotation, and the Chinese government actually used these particular title to drag out 3 reporters, Wall Street reporters based in Beijing, even though they have literally nothing to do with the virus, the title itself. So this might also be another sort of interesting implication that we might be seeing, i.e. the Chinese government using these sorts of unfortunate racist remarks or connotations for its own purposes. Thanks so much.
Terrific. So we can actually keep running. I know many of you have come to these events before. We can run for another 20 minutes or a little bit more. You've been very patient, but I know you've been quite compelled by this these remarkable presentations. So I want to open the floor to you for comments and questions. And of course, our panelists are free to question each other if you'd like. So let's just have as much of a conversation as we can now. Anybody want to make a comment or ask a question? Please.
Got a few, but I'll try to limit it quickly. I've been looking at my own paper by chance, and that's why I'm here, trying to figure out the authoritarian response to a place like China.
What's your paper? What's your paper?
I was looking at local government response, but contrasting if it comes here how we might be different than, say, local government in China. But trying to figure out if it's, I think the general consensus at the beginning, if it's China, it's a good thing because they can really massively mobilize and do some big things that other places could take a longer time to do. And with human rights concerns lessen, that maybe that's what's needed here. But trying to figure out, is that actually, is it a hindrance or helpful to have that? I think maybe in the end, maybe it's helpful at the beginning because of the closed communications and the censoring, and maybe that's the reason it got out of control to begin with. Just curious what the opinions are for anyone. Whether it's a good thing or a bad thing.
What's your question?
The authoritarian, so it being an authoritarian society with massive kind of control, or maybe it's weakening it, is that a good thing for a response to this kind of incident? Or is that a hindrance in several ways that actually made it get worse? Or
I think looking at the 2003 SARS epidemic, in terms of the quarantines and just how you can restrict flight access, in terms of imposing quarantines, an authoritarian regime is, I would say it's not better, but they're more effective because they can suspend human rights or personal liberties aren't as important. So if you just imagine if all of a sudden I drew an outline around the state of Oklahoma and said, hey, no one can leave, and everything shut down, no public transportation, I don't know that that would work in the United States. So from my perspective, if we look at the SARS epidemic, but also like I think you also point out, like, is it actually effective? Like, so is this quarantine effective at stopping it? And I'm not sure it is.
Keep in mind what's happening in China is utterly astonishing in the scale, right? You have 100 million people who have been in total lockdown for 4 weeks. you have half of the population of 1.4 billion people who are under controlled movements. And there's no other country in the world capable of even imagining to do that. And whether that is effective at slowing transmission or not remains to be seen. I think it probably has bought the government a certain amount of time, and it's bought time for those of us outside, more time for slowing the export of transmission. But in terms of the civil liberties side of this and the tolerance of local expression, we have civilian journalists disappearing. We have repression and detentions. We have people who are being pulled out of their homes and put into these new mass facilities on the basis of fairly scant kind of clinical diagnosis. So you find yourself visited at your home, and you could wind up in one of these facilities with no recourse, right? And there's discussion around whether that then puts you at risk. You may not be infected. You may simply have a cold. But so there's lots of different layers of discussion around this. We have here in the United States, we have quarantine powers that exist as law. The very narrow application of the quarantine powers have been put in place by those American citizens who are returning from China. And there are a certain number of people that are in quarantine today. I forget what the number is. It's about 1,000 at the moment, somewhere about that number. And those are fairly narrow, but we have not invoked quarantine powers in this country since 1963 during the smallpox outbreak. So if we have if we have community transmission, that is human-to-human sustained transmission in the United States, in the future, you're going to see quarantines imposed in the United States, and you're going to see disruptions and the invocation of those powers. I don't think and I think this is consistent with what Ashley was suggesting, I don't think our government has anywhere near the capacity that the Chinese government has to impose draconian measures of this kind, scaled at that level. But also, you need to keep in mind that our capacity in terms of our public health capacity is so vastly superior to what the Chinese have. We have, CDC has 14,000 trained, highly skilled employees. It has 10,000 contractors who can be summoned. We have across the United States at state and local levels 200,000 public health officials. And so just when you look at the basic capacities to respond, it's miles beyond what the Chinese have. And one has to begin to believe that your resort to authoritarian draconian measures are when things are out of control. And keep in mind, the government stumbled and repressed notification and action on this for somewhere in the range of 6 to 7 weeks. And it was in those 6 to 7 weeks when this really took off. So if there had been greater honesty, transparency, accountability, and action at an early moment, China would be in a much different state of affairs than it is today. There's also been discussion around the fact that the genetic sequencing data suggests that this actually began in November, in early November, not in mid-December. So there's all this discussion around that. Did you want to add?
So that's, I think I absolutely agree with Steve in the sense that if there were greater transparency to begin with, we might not have seen such a spread, at least outside of the Hubei province to begin with. And the second point is that some of the measures, the draconian measures, they're not necessarily that useful because it could be overreaction. So for a province that has only about 1 or 2 cases, why lock down the entire province in the community, which is not good for economic development nor the personal freedom, as well as affecting the actual daily life of a lot of the individuals. And the third point is that the quarantine might be a measure of a last resort because of the lack of capability of the Chinese government, especially in the public health sector, right? So they locked down the entire Hubei province, but there's no follow-up measures for that particular province. They're running out of hospitals, and they built 2 hospitals, obviously, impressively, but again, there was not a follow-up with regard to how to take care of those who are not affected, but those who have chronic diseases, etc. So I wouldn't say that it's effective in the first place. And if anything, it's almost like the central government decides to sacrifice Hubei province. I think, well, in order for the disease to be prevented from spreading to the outside provinces.
I'm gonna let you guys just pick the hand if you see, okay?
The most obvious one.
Teach food security, and I'm kind of interested. I read that the origin of the virus was animal, respiratory, and I was wondering if that's true. And the question is, if it does originate from animals, does it have food security implication ultimately?
So,
Zoonotic.
zoonotic diseases. So obviously, if it's a zoonotic disease, it does have implication in animals, especially if it affects livestock or other animals that are eaten. But I don't know that there's definitive evidence that it is like that where exactly it came from, unless it's been published very recently. That there's definitive peer-reviewed evidence that it's come from a zoonotic source, and what zoonotic sources come from.
The coronavirus, it's thought that this emanates from an animal species, but we don't know precisely which. And it could be two. And it could be a combination of a bat and a pangolin.
Or a civet.
Or a civet in SARS.
Yeah.
And there are live animal markets in China, which were the source of SARS, the civets and the bats, and those were closed but then reopened. And the original claim was that it had originated in that Wuhan market. There's now a question around whether it originated somewhere else, but we don't know the actual animal source. We don't know what reservoirs it resides in. There was reference made to the fact that there's claims that perhaps this was a result of accidental release from the biosecurity lab 4 level in Wuhan. China has one such lab, it's in Wuhan. Those allegations are very dangerous. The White House Office of Science and Policy, the White House Office of Science and Technology Policy, requested our national academies to bring together, this was about a week or 10 days ago, to bring together a number of experts to chase down this rumor and show some judgment on it. And they looked at the genetic material and they said the genetic data that we have shows that this was not a engineered, this was not an engineered virus, it was a naturally occurring virus. So they've tried to put that to bed. But the internet is full of crap. And there are people who are using this for other purposes as well. And it's been validated by senior elected officials too. So it's one of those dangerous rumors that hopefully will be put to bed eventually.
When we saw the little dog all wrapped up in plastic, can it be transmitted from humans to animals?
So again, I don't know that we have evidence that even a dog can be infected. There would have to be some studies done in terms of injecting dogs or looking at the antibodies in dogs, but I'm not sure that we even have any evidence of that.
Phil, remember they do eat dogs in China.
Now, on your food security issue, there's one really important thing to say here, which is China has been struggling with the African swine fever. And that affects the pork marketplace, and the Chinese derive about 70% of their protein from pork. And the pork market has, because of African swine fever and the deliberate destruction of infected populations, that market has been reduced by 1/3 to 1/2. And price levels have gone up, and it's been extremely uncomfortable for people and unpopular. Other sources of protein have been inadequate to fill that gap, and importations don't even begin to cover that gap. So people turning to chicken or to lamb or other alternative sources. So we already entered a period when this coronavirus appeared, a period in which there had been an unsettling spread of infection that had affected people's food security and their market, and they were upset and distrustful of the government because they felt the government hadn't been transparent and clear about what was going on, and that they were slow to respond. So you have that as a very important backdrop. If it's proven that this emanates from the coronavirus, if this were swine flu or avian flu, you'd have those populations destroyed in large segment and taken out of the market. So far, that's not happening here. Pangolins, which people are speculating may be the source, they're a trafficked, very rare sort of animal species. We don't know definitively if that's the source or the reservoir.
So real quick, the WHO sit rep for today actually had a whole focus on food and talked about how they haven't identified what that intermediary animal is. So they have a whole thing on food if you're interested in the food security part. But my question was, regarding the number of reported cases, you said that anecdotally it's probably 20 times what's being reported. Do you think that's a matter of the government restricting the information, or the government logistically not being able to collect the information, or people not reporting that they're sick in fear of the ramifications?
I have yes.
Okay.
I also think in terms of diagnostic testing, usually you have to meet certain criteria to even get tested. So like, I have to have a fever for so many days, certain kind of symptoms for even me to get a test. And the testing wasn't available for quite a while until it was approved by WHO. Some tests in China, Germany, and now the CDC has testing, but you have to have an approved test to get a confirmed case. So there might be a lot of cases that we don't even know about, but I think it's a mixture of all the things you said.
So we might see that 2.9% come down now that
Yes.
there's more diagnostics, or do you think it's going to stay fairly low in terms of number of cases reported because of the other things?
I would assume that it's going to go down, but I know that, like, I do think there's more deaths too that aren't being captured, but I think there's a lot more people that haven't been confirmed diagnostic testing, like, has not been done on more
So it's
people.
probably more of a technical than a social.
Yeah, I mean, the mild symptoms and asymptomatic infected people are not being captured. And I think that's what we're referring to. People just, it makes common sense. And their testing capacity has been very, very limited, and they've been overwhelmed. So there's a long history of this government underreporting infectious outbreaks and holding the data very close. So there's a habit there which is not going away, but there's also a capacity constraint. So I think we need to kind of be careful there. Keep in mind also the data that they released this week, which said a 2.3% fatality rate, the Chinese release of their data for the first time, also said there was a 14% severe illness on top of the fatalities. Other estimates are putting that at 20%. That has very serious implications for any country that has an explosive outbreak, because that will overwhelm your system very rapidly. And what we're seeing in Wuhan, where they built these crash, very large hospitals. They built two, one at 1,000 beds, one at 1,500 in 10 or 12 days. They just announced today they're doing another 17. They built, I forget, 20,000 beds in this last period. They're going to add another. That shows you the rocketing unmet need of severe illness.
I also go to imagine you're in China and you've been in your house for 14 days and you start getting a headache and a cough, and you see that the hospitals are overrun, people in the healthcare industry are getting infected and dying, there's no cure, there's no vaccine, and then you have to try to leave your house in, the plastic bag jump up, or an orange? Might as well, this is my personal opinion, might as well just stay home and try to ride it out.
That's what I was curious about. If there's, I mean, it's an authoritarian country, but are people as individuals kind of rebelling against that, reporting self-interest and staying inside? And is the government, is it passive in terms of individuals come forward when they're feeling sick, or is there more active surveillance by the government in terms of going to people's houses and making sure there's no ill people in the house?
I think I would say both, especially with regard to sort of the ethics center. I think the government sort of claims more credit than it does. For example, I think the Wuhan government says that previously that it has gone to 98% of the communities to check their physical temperature, etc. But there are a lot of posts on social media originating from Wuhan that they're not part of the 98%. So I guess the government is actually not doing enough in that way. And also related to sort of the fatality rate or the actual numbers, one thing to note is that we probably 2 weeks ago or a week ago, the sort of the Chinese government changed the criteria. So not from the testing, but through the clinical sort of results like CT scans.
Then they reversed themselves.
Yeah. If you see on the chart that I showed up earlier, there's a huge spike because of that.
Right.
But it could be the sort of the push on the part of the doctors, because that's sort of how they basically confirm whether that's the case or not. The other thing to note is that there might be a huge difference in terms of fatality rate between those outside of the Hubei province versus those within Hubei province. Because those outside of the province, they have a lot more access to medical resources. So for example, for my province, we have about 230 cases, but only maybe 3 deaths.
Yes.
If this does become a global pandemic, which parts of the world do you think will be hit the hardest?
I would say like countries that have lower health infrastructure, large cities, because of the person-to-person spread with close proximity. But I think in terms of if you have a health infrastructure that is not prepared for a pandemic or almost at capacity right now, it's obviously going to hit those countries harder.
If it becomes a pandemic, there are 4 or 5 scenarios on how that might unfold. It's not just one single. So there's a lot of variations of people talking about it. And one of them is getting an uncontrolled outbreak in a series of large urban centers. And obviously you have plenty of those with close proximity to China in neighboring countries. I think people were really shocked at the petri dish phenomenon on the cruise ship, and recognizing, 1 in 6 infected and it uncontrolled. In terms of Africa, there's 13 countries that have been identified as those most vulnerable in terms of the density of traffic between China and those countries, and only 2 countries as of last week had any testing capacity among them, South Africa and Senegal. There's a crash course right now, but you don't have much there in the way of the kind of testing capacity required for this. Here in the United States, we have, we've had trouble in putting together what's called the PCR test, the nucleic acid test, and we've had to pull that back because of false positives. We're now deploying into 5 cities in this country to try and, under 5 major cities, trying to determine how much disease is there in these cities. And that's Atlanta, New York, San Francisco, LA, and Chicago. And we'll know more soon as to how much disease there is in the United States that we don't recognize. The low-income countries, those with very weak infrastructure, are going to be vulnerable. One thing I wanted to add to the comments around the Walter Russell Mead's op-ed in the Wall Street Journal. The titling of it, very unfortunate in having racist overtones. The actual article itself is one that is saying that Xi Jinping's mode of governance in this dictatorial, intolerant, repressive manner of controlling the facts and engaging in deliberate falsehoods, et cetera, was a reflection of fragility and insecurity, and that it was revealing the vulnerabilities and the inadequacy of this mode of rule. And Mead is not the only person putting that argument forward. There's a very, very prominent intellectual at Tsinghua who wrote almost exactly the same thing in a speech, and he's been detained and stripped of duties. And there's been 5 or 6 other editorials that are very, very similar, coming from both Chinese and non-Chinese intellectuals in the last 10 days. And so this theme is out there and is being hammered and hammered and hammered, and it's drawing a very, very strong reaction from Xi Jinping and those around him. This is a crisis of governance. This is a crisis of legitimacy. This is unlike anything that he has faced in his pretty remarkable tenure. But it comes against a backdrop of a slowing economy, of an aging population, of all sorts of trend lines internally within China that make people nervous. So we need to put this in that context, and those that are hitting the hardest are getting very strong reactions from this government around these kind of critique, this line of critique, which is seen as very threatening.
Why don't we do one or two quick questions and then we'll wrap up?
So, what was your estimate of the probability that it would not become a pandemic? And what would have to happen or be implemented to prevent it?
Probability of not becoming, I would say, if you do the definition of spread among multiple continents, I think it's probably going to happen, that there is going to be spread among multiple continents. So I think it's highly likely. And then the other part of your question?
Well, the other is, take this country then, what has to be happening in terms of preparation, mobilization, training, implementation, funding, that
So I think the CDC is preparing like the diagnostic testing and deploying that out to different cities. So I think that's obviously very important, making sure that we have infrastructure in terms of personal protective equipment, respirators for when people do get sick. I think in terms of preparing, we're as I mentioned, people are looking into repurposing of antivirals and looking to making new vaccines for this. So I think we're doing a lot that we can do, but obviously you can always do more in terms of educating our public. We run our hospitals pretty high in terms of the capacity level, so we don't have a lot of extra beds available, and especially infectious units available that are just sitting around ready to go because of some of the Ebola crises and SARS.
we can't build one in 10 days.
No, I don't think our logistics and acquisition process works like that. But I do think if you look at, just for instance, Ebola deaths and fatality rates in the United States versus others, because we have better supportive care, more modern medicine, I'm not sure the case fatality rate will be the same, especially if we have isolated spread among certain cities rather than, again, the whole country. So hopefully that we're better prepared with more supportive care, sterilized equipment, or equipment ready to go, that we will be better prepared than other countries because we've had an investment. One thing to note is that unlike with hurricanes or earthquakes, we don't have a special set of funds set aside for infectious disease outbreaks. In terms of, so every single time it has to go through a supplemental funding. So I looked at Ebola and also Zika funding. So that sometimes becomes a political issue because it has to go through Congress to get that funding instead of having a special reserve on the side. So yeah, unlike an earthquake or something, like you declare that public health emergency, there's not a pot of money that they can use for coronavirus specifically until Congress appropriates that funds. So that's something where we need to look at and encourage funds be set aside, because it's not a question if the next epidemic is going to happen, it's when.
Can I add just two quick points to that? If you go and read what Tom Frieden is saying, or what Tony Fauci is saying from NIH, or read some of the other major epidemiologists who've been watching this and commenting, sentiment has shifted very much to the opinion that this is globalized and is not going to be contained. And that and very strong. This was something that was being said behind closed doors 10 days ago. It's being said openly and daily today. We need to prepare for this. We need to prepare for this, including Robert Redfield, head of CDC. In terms of what we should be doing, I think Ashley made very clear we need to expand a whole bunch of capacities. We will not have a vaccine, but we need to be getting that moving along. We'll be relying on social distancing. We need infection control, very effective infection control in our clinics and our hospitals. And we need people to stay calm and change their behavior in terms of there will be suspended mass gatherings, there will be people not going to work or working from home, there'll be all sorts of measures taken. Washing your hands becomes critically important. Congress is having a series of hearings that they'll be intensifying next week. And the debate around when do you lean forward and ask, when do you begin to lean forward and plan strategically and ask for forward funding in order to amp up your preparedness? And when does the administration come forward with a proposal or request that there be a major supplemental funding? In the Ebola case, it came late in 14 at $5.4 billion.
And then Zika, that was also, took a while, you know, and it became a political issue.
Yeah, it got delayed for 9 months. So the administration right now has only reallocated $135 or $136 million. That's been the only thing that's happened so far within the administration in its preparedness for this. And that's simply a reallocation of funds in a very modest level. It's this bind of when do you decide to pull the trigger and really lean forward and start spending lots of money, aware that it might not be necessary and you might be faulted for buying the wrong things and putting your money in the wrong places. But if you screw it up and you're too late, it's Katrina times 10,000. And if Trump wants to get reelected, he can't blow this. And an enormous amount will ride on this. He's created a task force led by Secretary Azar, which is meeting, and there is a very active interagency process around this on the deliberative side. And as I said, the dialogue with Congress is very active, and Congress is pushing for what do you need and what do you want, and when are you going to come forward, and what kind of supplemental is it going to be, and how long do you wait? What are the conditions at which you then say, okay, the probabilities, we'll never know for certain what we're facing, but we have to make a decision one way or the other.
Perfect set of public policy issues. Very last question. We're going to let people go.
Okay. Yeah, real quick. What aspects of this outbreak do you think are most likely to impact China's Belt and Road Initiative?
Well, those 13 countries that are in Africa that are the most vulnerable are the strongest partners under the Belt and Road. And the Belt and Road, you know, is $1 trillion investment in infrastructure. And there's very little of that money that goes into public health preparedness and infrastructure. And that's been a critique for a very long time, that when you open up these channels of interactions and interdependence, and you don't build in public health preparedness capacity, something like this happens. You've got transmission belts that could do this. So it does beg that question of how the Belt and Road could become a vulnerability, or an axis for transmission.
And in addition to Africa, maybe Southeast Asia as well, because obviously they're China's neighbors and also part of the Maritime Belt and Road Initiative. For example, Vietnam. I know we've seen some of the cases happening in Vietnam and in other cities, other countries in Southeast Asia, Singapore as well.
So I just want to thank this wonderful panel for our first event. March 4th at noon. We're having Daniel Gersten speak about his new book, The Story of Technology. So I hope that many of you will be able to come to that. But I really extend the deepest thanks to Steve Morrison, as you can tell, a national authoritative voice on these issues in many dimensions. I didn't get to use up time for you to tell us the story of creating the Global Health Center, but really has been a pioneer in making the connection between global public health and international relations more broadly, and really a very formidable player in this field. Ashley, it's great to meet you, and your students here are very lucky to have you. Ketian, we're so glad you're back, and you're safe, and you're healthy. So, yes.
I think you should have led with that.
Thank you all.